Doctors and nurses have very similar goals for their patients as teachers and principals do for their students. Both fields have the ability to impact kids in very important lifelong trajectory kinds of ways, but until we can get them to talk to each other, it's really hard to be able to make the most out of those two systems.
Students who visit the school nurse more than once for social determinants of health are at an increased academic risk. We also know that students going to the nurse more than 8 times in a school year face significant academic risk when compared to their peers. Our children are visiting doctors and hospitals no more than 80 minutes annually, with impoverished children encountering the healthcare system even less. Poverty-stricken students are 13 times less likely than wealthy peers to graduate on time. But if we form a connection between a student's health information and academic support, we can achieve stronger educational outcomes, which then leads to improved long-term health outcomes. So, how can collaboration between healthcare professionals in schools help?
An opportunity that allows you to take data from the health field and correlate it with the education field, and to say we can now say X, Y, and Z with certainty, and our ability to help a doctor give a child better care and an ability to give a teacher the ability to serve a kid better in a classroom, that is an absolute game changer. We have never been able to do that before.
Absolutely, socioeconomic status affects health outcomes. There is very good data that shows that the zip code that you're born in may be one of the biggest factors predicting your ultimate health outcomes. We're really redefining what the definition of health is.
Right now, Paramount Schools of Excellence is sharing data and improving outcomes while bridging the gap between healthcare and education.
There are quite a few barriers that get in the way of cross-sector collaboration, especially between the health industry and schools. The first and most obvious barriers are the privacy laws that protect each of those industries. On the health side, you have HIPAA. On the education side, you have FERPA. So it takes a lot of work to really bridge that and create some cross-sector communication to say that FERPA and HIPAA can coexist and help both hospital and family.
So, how do we help? With the Paramount Health Data Project, we're connecting healthcare and education, comparing comprehensive health data alongside school data. This allows both sectors to improve long-term outcomes for children. We're sharing the data and providing students with additional support to put them on track for better education and a healthier future.
We need to be able to act on this data because we all know if we act quickly, we can identify students who are potentially at risk, and we can provide extra supports to get them through that risk with the potential for graduating high school, with the potential for scoring better on their state exams, with the potential for performing and lasting longer in a classroom setting without having their health condition or stressors make it impossible for them to learn.
With better educational outcomes leading to longer, happier, healthier lives, it's time for administrators to connect data from these industries and make a change for tomorrow together.